Everyone, this is Dr. Kiran. Today I'll be dealing with AIPGT 2023 repertory previous year questions. Okay, so before I jump on to the actual topic, okay, so there's something which I need to bring to the notice of all the aspirants of AIPGT 2024. So NTA has released the subject-wise weightage in homeopathy for AIPGT 2024. Okay, so this is the most important aspect. So you get to know what subject is given, how much weightage in this examination. Okay, so dividing it into two broad aspects, you have homeopathic subjects and then the allied subject, or what we call it as pre and paraclinical subjects. So in the homeopathic subjects, 60 marks, 60 questions come from homeopathic subject. The rest 60 will come from the allied subjects. Okay, so under homeopathic subjects, materia medica carries 16 questions, organon of medicine carries 16 questions, repertory carries 16 questions, as well as homeopathic pharmacy will carry 12 questions. So these are the four subjects which can fetch you more number of marks and will help in fetching good seat in central as well as state government institutions. So moving on to the repertory part, so you have 16 questions in AIPGT 2024 for repertory, whereas today whatever I am dealing, so that is 2023 questions, previous year question, that has 15 questions from repertory. Okay, so before you start with the actual repertory portions, you should be knowing BTPB, of course, it's Boningosson Therapeutic Pocketbook, and then you have BBCR, as well as the magnum opus of the repertory field, that's the repertory of homeopathic materia medica by Dr. J.T. Kent. It's also called as Kent's repertory. Okay, so moving on to the first question. So here this is a clinical question where the patient presented with complaints of burning in soles at night. So this is the typical presentation of the diabetes as well as vitamin B12 deficiency. So you need to hunt the rubric for this particular symptom. Okay, so this is what the patient is representing. So now you need to, so I have given in the symptom form burning in soles at night. So how do you convert it into rubric in Kent's repertory? So burning is basically a sensation or a type of pain. So the first rubric, what do you find is in the extremities chapter. Okay, so because his soles is burning, you need to see the extremities chapter. Under that you have a rubric pain. Okay, so under that you have a sensation burning. After that you have foot, then soles. Okay, and then the time modality. As you know, Kent repertory is arranged based on the STME pattern. Side is not given, so directly jump into the time. Under time modality, morning, afternoon, evening and night sub rubrics will be there. So here direct rubric is night. Okay, so then now you need to find the right option. Extremities, pain, burning, foot, sole, night. So this is the exact rubric for the symptom burning in soles at night. Moving on to next question. Again, this same question has been asked from the Kent's repertory itself. Again, the question is regarding rubric hunting. Okay, so again here, which of the following chapters have given rubric freckles? Okay, so under that you have skin, generalities, nose and mind. Okay, so you need to select the options according to the appropriate answer. Okay, so they have already given a rubric. You need to find the chapter in which the rubric is given. Okay, so by this question you understand that because in the option they are given A, B, C, D, A, C and B, D. Okay, so here it is understood that this particular rubric freckles is given in multiple chapters. So you need to know in which all chapters the freckles is given. So before we understand freckles, we'll see what is freckles. Okay, so freckles are flat toppy lesions where you have no very prominent in the sun exposed areas. So here this is the picture of the freckles. You can see the freckles in the face as well as on the nose. Okay, so here in the Kent's repertory it's given in face chapter. It's also seen in nose, in general as skin. Okay, so directly jumping into the rubric, you have direct rubric face freckles. Under nose chapters you have freckles and skin chapters also you have freckles. Okay, so I have mentioned few of the 3-mark remedies under the particular rubric. So now what is the answer? You have it in the face, nose and skin. Okay, so here since nose is not given in the option, So it's clearly ruled out. Sorry, since face is not given in the option, so face chapter is clearly ruled out. You only left with skin as well as nose. So in the Kent's repertory, you have it in the skin as well as in the nose. So the correct option is option 3, A and C only. Moving on to next question. Which of the following rubric from BBCR is not given in the mind section of Kent's repertory? So this question is basically a comparison between two repertories, that is BBCR as well as Kent's repertory. So you should know rubrics from Kent's repertory as well as from the BBCR repertory. The question is, there is some rubric in BBCR repertory which is not mentioned in Kent's repertory. Okay, you have four options: positiveness, playful, passionate, and professing. So let's move on to Kent repertory first. Okay, so in the Kent repertory, the most important chapter is mind rubrics or the mind chapter. So under that there are rubrics like playful, pleasure, positiveness, and professing. Okay, so you don't find the rubric passionate, but you find the rubric passionate in BBCR repertory. So under BBCR there is a chapter called mind chapter. Under that you have a rubric passionate, hasty temper. So this particular rubric is not found in Kent's repertory. So the answer is option 3, passionate. Moving on to next question. In which of the following chapter of therapeutic pocketbook prostate is mentioned? Okay, so this is a question based on a BTPB repertory, and there are four options: urinary organs, urine, micturition, and sexual organs. To describe it in brief, sexual organs deals with male and female genitalia related symptom. Micturition is something only with the urination, say for example involuntary urination, dysuria, or painful urination. The rubric or the symptoms related to particular micturition is given in the micturition chapter, whereas in the urine, the character of the urine, odor of the urine is given. Okay, whereas in urinary organs, so the general idea of the organs has been given. So in the under BTPB urinary organs, you have kidney, you also have bladder related pathologies, and you also have urethra. So this is not ureter, this is urethra. Under urinary organs you also have urethra, and then last but not the least, prostate gland is also given in the urinary organs. So the right option is option 1, urinary organs. Moving on to fifth question. Okay, so this is basically a match the following type of question, and match the following questions are quite easy because most of the options even suggest the answer for you. Say for example here, to my in the right side of the column you have rubrics, and then towards the left you have BBCR. Okay, so chapters. So you need to identify the right rubrics and fit the chapter exactly. Okay, so here if you see the options, okay, so option 1, 2, 3, and 4, if you see the first one, homesickness, and majority of the given thing is 3. Okay, so 3 is homesickness is related to mind chapter. So easily you can rule out the option 3, where the homesickness rubric is given as the chapter 1, sensation and complaints in general. Okay, so I will be dealing with the individual rubrics. Homesickness is a person, is actual definition of homesickness is when a person is away from the home, he thinks of the home. So most of us might have been suffered from this kind of symptoms, right, whenever we are away from the home. So this is a mind symptom actually. So you have mind symptom, homesickness. So under mind chapter you have homesickness, and there was second rubric, lumbricoids. What is lumbricoids? So with your parasitology knowledge, you know that there are many worms, Ascaris lumbricoids, pinworms, and other worms as well. So in BBCR, under stool chapter you have a rubric worms. Under that you have type of worms. So under that there is a sub rubric lumbricoids. Okay, so moving on to the next one. Next one was epilepsy, or what we call it as convulsion. Okay, so this is a in general process where there are many types of epilepsy: tonic epilepsy, tonic clonic, absent seizures. Okay, so seizures, since there is general involvement of the entire body, it is mentioned in sensation and complaints in general chapter of BBCR repertory. Okay, even in Kent's repertory there is a rubric convulsion directly given in chapter generalities. Okay, ebullition is something related to circulation where there is bubbling or boiling of the blood. Okay, so the right option is option D. Okay, homesickness is seen in mind chapter, lumbricoids is seen in stools, ebullition is seen in circulation chapter, and epilepsy is seen in sensation and complaints in general. Moving on to next question. Which of the following rubric is not mentioned in generalities chapter of the Kent's repertory? Okay, so this again generalities chapter is one of the important chapter in Kent's repertory. So there are four options: nursing children, old people, menopause, and stooped shoulder. Okay, so if you see nursing children, there is a rubric for children who are having no who are nursed by their mother. Okay, so you can consider it's a general symptom, right? So it's a duration of age, so you have it in generalities. Again the old age. Okay, so complaints related to old age, if there are multiple complaints, you can directly consult the rubric generalities old age. And then stooped shoulder. So stooped shoulder, it's again based on the appearance of the person. So these three rubrics are in the generalities chapter. Okay, so stooped shoulder, again I have one single 3-mark remedy is sulfur. Okay, you might be listening to your Mathematical classes, your professor might have told that sulfur personality is very lean, thin, stooped. Okay, so again 3-mark remedy is sulfur. So all these three rubrics are seen in generalities, whereas menopause rubric is seen in the genitalia female chapter. Okay, so under menopause rubric you have it in genitalia female. So the right answer is menopause. Okay, and before I move on to the next question, always read the questions very thoroughly. So here if you see which of the following rubric is not mentioned in generalities chapter, so they have asked which chapter is not there in generalities chapter. So that is why the answer was menopause, because it was in female genitalia chapter. Moving on to next question. Question number 7. Which of the following repertory in which abdomen is mentioned as the first chapter? Probably this was the most easiest question in 2023 AIPGT. Okay, so here there are 4 repertories given. Synoptic key of the Mathematica, it is by Boger. Synthetic repertory by Barthel and Clunker. Repertory of Herring's guiding symptom of our Mathematica, nothing but the nurse repertory. Okay, and concise repertory of homeopathic medicine by S.R. Photak. So you know there are 4 repertories. Okay, so what we need to know is the arrangement. Okay, they have asked the abdomen. Okay, so abdomen is the first chapter in which of the following repertory? Synoptic key, again it's based on the Boger's ideology, so it also contain a Mathematica as well as a repertory. So synthetic repertory is based on Kent's philosophy. Again there the first chapter is mind, and then repertory of Herring's guiding symptoms of our Mathematica by Nair. Again there the first chapter is mind and disposition. So and the final rubric, final option is a concise repertory of homeopathic medicine by S.R. Phatak. Okay, you might be knowing the famous Phatak's repertory. So here this is the repertory. Okay, so a concise repertory of homeopathic medicine, and if you see the tagline, it's mentioned alphabetically arranged. Okay, so whenever it's alphabetically arranged, so here there are nothing like the chapter as such. So the rubrics are arranged in an alphabetical order. And one more example for a alphabetical repertory is Murphy's repertory. Okay, so the right answer is option 4, concise repertory of homeopathic medicine by Dr. S.R. Phatak. Moving on to next question. Which of the following rubric is not given in the section of phase chapter of Boningossen's therapeutic pocketbook? So this is a question based on BTPB. You have 4 options: calm downs, and then yellow saddle across upper part of the cheeks and nose, and third option is drawn, and fourth option is parotid gland. Okay, so whenever you see such kind of question, you should be really smart to answer it. Okay, so for example, so this is actually the easy question if you know the particular aspect of the repertory. Okay, so in the BTPB chapter, see now you can't master all the rubrics for AIPGT. to uh, to know each and every rubric will be little difficult. Okay, and it's actually impossible also. Okay, so in the whatever less time span is left, you need to be little smart. Okay, so in BTPB there is something called as misplaced rubrics. Okay, misplaced rubrics of BTPB should be known in hand. Okay, you should be very thorough with BTPB misplaced rubrics, because every year they have been asking the same question very repeatedly. So under misplaced rubric, parotid gland has to be given in the ear chapter. Okay, so the question what they have asked was which chapter is not given in the face chapter of the BTPB. So the right answer is parotid gland. Okay, so you need not be confused with no all the three rubrics, all the three options given in the BTPB. So if you know the direct misplaced rubric of the BTPB, directly you can answer this question. Okay, moving on to ninth question. Tendo Achilles is mentioned in which of the following section of the therapeutic pocket book? Again the question is from BTPB. So there are four options given: lower extremities, sensation, skin and aggravation. So in general, tendo Achilles, or what we call it as Achilles tendon. Okay, so you know the anatomy, right? You already studied anatomy, and you know this is the tendo Achilles. Okay, so Achilles tendon again, it's a combination of gastrocnemius as well as soleus muscle, where it gets inserted in the calcaneal bone, in the posterior aspects of the calcaneal bone, right? So the Achilles tendon itself is related to the lower extremity. So in the BTPB, this is a very easy question as well. So the direct answer is lower extremities. Moving on to next question. In BBCR, under the aggravation and amelioration in general chapter, which of the rubrics is mentioned? Okay, so again A, B, C, D, four options are been given: influenza, uric acid diathesis, hemophilia and anemia. So under that you should arrive at the appropriate option. Okay, option is A only, B only, C only and D only. So BBCR, as you know, the unique feature of BBCR repertory is the pathological generals. The rubrics related to pathological generals are given in a chapter called as sensation and complaints. Okay, so this is the BBCR repertory. So in that there is a chapter called sensation and complaints, which is very unique, where the pathological generals are being given. So here in the options, if you see, influenza, uric acid diathesis, hemophilia and anemia. Anemia, influenza and hemophilia, actually they are mentioned in sensation and complaints chapter of BBCR. Okay, so but there are exceptions. Pathological general, there are two pathological general which are mentioned. Actually it's a misplaced, but it is mentioned in aggravation and amelioration chapter of BBCR. Okay, so two other rubrics are uric acid diathesis and senility. Okay, so though they are pathological general, they are by mistakenly mentioned in aggravation and amelioration chapter of BBCR. So the right answer is uric acid diathesis, option 2 B only. Moving on to next question. Question number 11. In Kent's repertory, the cross reference given for the rubric resolute is. Okay, so this is kind of a direct rubric where you need to know the cross reference of many mind rubrics in Kent repertory. It is mentioned in, it's very clearly given in Shashikant Tiwari. There are very few rubrics, but if you are able to recall it, that will be very helpful for AIPGT 2024. So you have remorse, repulsive, courageous and careless. Okay, remorse is kind of a guilt feeling. Okay, so again that is not the cross reference for resolute. And repulsive is something against the authority, so that is what we call it as repulsive. Careless is heedless, so where there is lack of there is, for careless there is a direct cross reference, heedless. Okay, so that means there is no seriousness and there is lack of care. Okay, and for this question the answer is courageous. Option 3, courageous is the answer, and this is the confirmatory cross reference for resolute rubric. So there are two types of cross references. One we call it as confirmatory cross reference, that means after the rubric the remedies are not given. So those type of cross reference are called as confirmatory cross reference, whereas after the remedies, after the rubric, if there are remedies given, those kind of cross reference is called as comparative cross reference. So question number 12. In the context of generality section of Kent's repertory, which of the following rubric is given when too much medicine has produced an oversensitive state and remedies fail to act? So here they have mentioned the Kent repertory and also the generalities chapter. They have asked you to hunt the what is the exact rubric for the below mentioned symptom. Okay, so here there are four rubrics, four options: heaviness, lack of vital heat, weakness, irritability. Okay, so heaviness is kind of ruled out because you can't tell that no drug overdosage is little heavy, so that's not the right terminology. And lack of vital heat is the rubric actually for the chilly patient to see whether the patient is chilly. So the rubric for the chilly patient is lack of vital heat. And weakness in general, you have generalities weakness, direct rubric is given. Okay, so it has no association with the medicine oversensitivity production and whenever the remedies fail to act. The last rubric is irritability. Okay, so the right answer here is, I will show you in the Kent repertory where actually it is mentioned. Okay, under Kent repertory generalities chapter there is a rubric irritability when too much medicine has produced an oversensitive state and remedies fail to act. There are two remedies, phosphoric acid and teucrium. So teucrium, TMV you might be knowing, teucrium marum varum. So 3 mark remedy is teucrium. Okay, so most of the time you rule out no irritability very easily because you think it Kent's mind rubrics is considered to be irritability. But here the even in generality section there is a rubric called as irritability, whereas this is physical irritability due to the overreactions of the oversensitive state of the drug, and whenever no other remedies is acting because of the oversensitiveness produced by the drug, the remedy of choice is teucrium marum varum. So it's in 3 mark, very thoroughly verified as well. So this is option 4 is the right option. Moving on to next question. Question number 13. So this is a statement based question. Okay, so and these questions should be attempted very carefully because there are two statements, and if you have confusion in one or if you don't know both the statement, better to quit these questions because the probability of the answer getting correct is very low if you don't know the entire concept. So you need to know the concept of Kent's repertory very thoroughly for this particular question, where the statement 1 is general rubric will include all the remedies that are related to the symptom. Okay, and the statement 2 is under rubric itching of the palm there are number of remedies but anagalis is not included, though in sub rubric itching palm rubbing ameliorates anagalis is mentioned. Okay, if you don't know anything about the skin itching of the palm, or also in the extremities section if you have not seen the rubric and if you don't know the remedy anagalis, better not to answer this question. Okay, so if you know the statement 1, see general rubric will include all remedies that are related to the symptoms, so that is right. Okay, statement 1 is right. And statement 2, if you have confusion, if your risk appetite is very good, then you can give a try for this question. But again the probability, if you know only one statement, the probability of getting answer correct will become low, so it will become less than 25%. Whereas if you know both the chances, then whenever it's 50% there is yes or no. There is only one question, 1 mark will be deducted if the question is wrong, and if you get it correct then you will be benefited with 4 marks. Okay, so here the answer is both statement 1 and 2 are correct. Okay, so for this you need to refer Kent's repertory extremity section for further detailing where the subrubric itching palm rubbing ameliorates anagalis is mentioned. Moving on to 14th question. Given below are two statements. Again similar question from Kent repertory where you have two statements. Okay, so this is the pattern of AIPGT question, because unless and until you know the subject very thoroughly, it becomes really difficult to answer these questions. Okay, so in generality section of Kent's repertory, in the rubric undressing after aggravation, medicine rumex is not mentioned. So let's get back to Kent's repertory and see under generalities chapter. Okay, so under Kent's repertory generalities chapter, undressing after aggravation, you don't find, you have rustox, you have pulsatilla, you have sepia, you don't find rubric, you don't find the remedy rumex. Okay, so here the statement 1 is correct. So and the next statement was in the generality section of Kent's repertory, the rubric vaccination after antim-tart is not mentioned. Okay, so we'll move on to the generalities chapter again to check whether this rubric is right or wrong. Under generalities chapter you have a rubric vaccination after. There you have epis, you have arsenicum album in the A series, whereas you don't have antim-tart in this section. Okay, so even the statement 2 is correct. Okay, so the right option is both statement 1 and 2 are correct. So for these kind of questions to answer, you should really know repertory in depth, then only you can answer this kind of question. But at least if you know one question or one statement right, then you can try answering this question, or else it's better to quit this question. Moving on to the last question, which of the following chapter of Kent's repertory? Again the repertory, again the question is from Kent's repertory itself. You will find the rubric coffee amelioration. Okay, so under that you have mind, stomach, mouth and generalities. Okay, so these are the 4 chapters they have given. We need to find coffee amelioration. Okay, so which chapter, uh, any guess, because these kind of questions are really tricky and guessworks may lead to fatal results. So here there are many rubrics or many sub rubrics where there is coffee amelioration. Okay, but in the question, if you look back the question, they have very clearly mentioned that it's just a coffee amelioration and no symptom is mentioned. Okay, no particular symptom is mentioned. But in Kent's repertory regarding coffee amelioration, there are many rubrics. You have mind confusion, which is better by coffee, and there are head pain, which is better by coffee, and stomach pain better by coffee. You have remedies like colocin for this particular rubric. But in this question they have asked coffee in general amelioration. Okay, so the right, if you see Kent's repertory, under generalities there is a rubric food coffee amelioration. So here you have 3-mark remedy chamomilla. So the right question or the right answer for this question is option D, generalities. Though you have in the mind chapter, though you have coffee amelioration, so it is only the confusion is better by coffee, and even the stomach pain is better by coffee. Okay, but here the question is very precise that they have not mentioned any particular symptom. So that is why the answer is option D only. Okay, so that is it's seen in generalities chapter, food, coffee, amelioration. So these were the 15th question which I have tried to deal with AIPGT 2023. I hope this was very useful, and always try to go back to previous year questions, see the questions, always solve it, because there is a tendency of AIPGT 2024 to ask such kind of previous year questions very repeatedly, and nearly out of 120 questions there are 5 to 10 questions getting repeated, and some year there is also a tendency to get 15 questions as well. Okay, and always be thorough with the repertory chapters, and also go through the years editions as well as the year of publication of the repertories and different types of repertories. Okay, but the recent trend what we are seeing is the in Kent's repertory, though it's even in BTPB as well as BBCR repertory, the majority of the question, okay, even in 2023-22, so the majority of the questions have come from rubric hunting. Okay, so you need to know the chapters in and out, especially Kent's repertory, BBCR and BTPB. Okay, so I hope this session was useful, and thank you all.